Welcome back to Midday Kentucky, everyone. Well, we are talking all about what is known in the medical world as venous disease. What is it? Well, we have Dr. Zadeh from Lexington Vein and Aesthetic Centre here to discuss it and break it down and also tell us what the treatments are available for this. Welcome to the show, my friend.
Thank you very much for inviting me.
What is venous disease?
Well, venous disease is the insufficiency or backflow of the blood in the veins that causes the problems.
Okay, so let's break it down. There are two types of, there's venous disease, I should say, spider veins and varicose veins. Is that correct?
That's the part of the superficial, which is basically the veins that are underneath the skin. Yes, that's correct.
Okay, so let's start with spider veins. Where would one normally see them on the body?
Well, mostly around the ankles, sometimes around the in the thigh region and the calf. So it can be seen everywhere in the leg.
Now, will they cause you as much pain as a varicose vein?
No, they don't.
Right.
Mostly they are cosmetic in nature.
Okay, so let's talk about treatments for spider veins to begin with. What is available for it to begin with?
Well, first of all, we have to make sure that there is no underlying disease causing those. And if we make sure that there is no underlying disease causing the problem with the spider veins, usually the sclerotherapy, which is injection of those veins with a special medicine to make it disappear.
That's an incredible system.
Yes,
I've seen that live on air. We're going to show it on camera in just a moment as well. But is there any downtime when you're having that treatment done?
No, not at all. You can basically get that treatment and
in your lunch break?
And your lunch break and go back to work. The only thing that has to be done is that you have to wear special stockings for 1 or 2 days.
Yes. Well, one of my colleagues have had that done, and she said it was, and to see it live, really see it being done, I cannot tell you. The veins disappear before your eyes. It's incredible. I still want to stay on spider veins. Does your insurance cover that type of treatment?
The common knowledge is that people think that it doesn't, but sometimes, in fact, it does.
Oh, so that's why we need to come in, make an appointment,
right,
and then check with your front desk, and they will also help you with...
Absolutely, and we always check with the insurance before we start the treatment for the patients, because they would like to know in advance.
I love that.
Yeah.
Okay, so let's talk about varicose veins. Now, this is something that affects both men and women, so do spider veins, of course. But it seems to be, they're the ones that everyone worries about because they can get the ugliest.
Yes.
And the most painful.
Yes.
And it's like, what do we do? Where do we start? How do we not get them? And then when we get them, what do we do?
All right. Well, one of the things that can affect not getting them is probably exercise.
Oh, really?
Yes. And avoid standing for a long period of time. Moving around and walking, running is always very, very good for the veins.
If you know that it's a hereditary issue in your family, does it help by massaging the legs and the ankles, or
no?
Well, I thought I'd give it a whirl. Okay, so let's talk about the treatment plan for these type of issues.
Well, before what was involved, it was called vein stripping. Probably most of your audience are aware of that, which was involved going to the hospital. They take you to the operating room under anesthesia. They made multiple cuts in your legs and basically removed the vein, which was a very morbid procedure.
Oh, I've seen that live as well, and it doesn't look great.
Yeah, but nowadays we do that in our own office without any anesthesia. We do local numbing medicine.
Wow.
No cutting is involved. We just use a single needle stick, get access to the vein, and we basically send a laser fiber inside the vein, and under ultrasound guidance, we basically get rid of it.
What's the downtime for something like that?
Well, it varies, but I've had patients who had it done and went back to work.
Really?
And I've had patients that probably took a day off. Mostly, this is funny, but men are generally worse than women in regards to tolerating the pain.
Well, of course, we're big babies. I think the most important thing is to catch it early.
Absolutely. It makes it very difficult for us to treat and a longer period of downtime if it's involved.
And also, everyone, if you do have varicose veins, of course, they will also be speaking to your insurance company, making sure that you're fully covered there as well for the procedure. We appreciate you coming in.
Thank you very much.
If you want to find out more information about Lexington Vein and Aesthetic Centre, there it all is up there now, guys. They're an incredible treatment centre for these type of procedures. We appreciate you coming in. We'll be right back after this short break, everyone.